Let's get it!
Broadcasting to you from a little grass shack in the middle of the Pacific.
Live in the place to be.
Well, they're actually in the Bay Area.
Yeah,
but they are the premier Faika show that shines a spotlight on positive Pacific Islanders.
You listening to the sound.
Role models coming brown every Thursday night at 6.
East to west, we getting hurt.
Brought to you by Pacifica by Design. It's the iconic Faika podcast with your hosts, Naki and Carl.
What's up, Naki?
What's up? Happy birthday.
Oh,
It's your
you had to
birthday.
get that
It's
out
your
there
birthday.
right
It's
in
your
the
birthday.
beginning. Well,
Yes.
good to get that out of the way because we got important people on the show today.
We do.
Let's see, we are going to forego the check-ins. We have and I always like talking about health topics because
It's important.
the Pacific Islander community definitely needs to plug in and be educated about all different types of health concerns. And this is a big one with the Pacific Islander community. So we are just going to hop into introducing our guests. I'm going to introduce Richard So. Richard is the executive director of SF Hep B Free Bay Area. Richard is passionate about fighting hepatitis B and liver cancer and making the San Francisco Bay Area the first hepatitis B free area in the nation. He has worked in healthcare for over a decade with a focus in public health. He previously worked for SF Hep B Free Bay Area, successfully expanding its screening and education program in San Mateo County. His exposure to hepatitis B public health work came years ago working in government affairs for SF Hep B free lobbying members of Congress to shine a light on this huge health disparity between Asian Americans and others. Richard has a master's in public health and public policy from Columbia University, and he's worked as a healthcare consultant and served in the U.S. Peace Corps as a rural health volunteer in Paraguay. Welcome, Richard. I think there you
Hello. Yes, sorry about that. Thank you. It's a mouthful of an introduction, but excited to be here and talk about an issue that deeply affects both the Asian American and Pacific Islander community.
Glad to have you.
Yes, welcome. Arlena Maliatulua is the new program associate at SF Hep B Free. She assists Richard in raising awareness about hepatitis B and its associated liver disease and cancer in communities, specifically in the Asian and Pacific Islander communities. We offer free education and Hep B testing at community events and private events as well. Something that she loves doing and is able to do at SF Hep B Free is having the opportunity to directly work with and in her own community. Lena attended City College of San Francisco with our producer Mena and her 2 daughters, and then in 2021 transferred to BYU Hawaii with a BA in Pacific Islander Studies and Foundational Foreign Language. Lena was raised in both California and American Samoa, and everyone has to post their high school, graduated from Leona High School in 1986. Welcome, Lena.
Welcome. So sorry I didn't hit the mute button, but thanks for having me, Naki. Good to be here.
Thank you so much.
Good to have you, Lena. We were in Samoa in 2019. We went to Flag Day, and we actually remarked on how big and large Leone High School represented at Flag Day. So when I read that, I was like, "Hey, they were the ones that really showed up that day."
Yes.
So
unity is our strength there.
Definitely. I think it was I don't know if it had the most participants, but they might have been the loudest.
Yes.
Probably both the loudest, maybe.
And also with us today is Stuart Fong. Stuart is the chair of the SF Hep B Free campaign. What he loves about working with Richard, Lena, and SF Hep B Free is engaging the community about an imprint and health issues and one of the greatest health disparities in our Asian and Pacific Islander communities. Welcome, Stuart.
Thank you. Thank you for having us and having us share information about hepatitis B.
Thank you so much for being here. We appreciate it because, we need the information. And a lot of people haven't heard. I mean, as crazy as this sounds, a lot of people have not heard of hepatitis B. Lena, can you start us off with what is hepatitis B?
Well, hepatitis B is a virus that stays in your liver, and you can contract it through blood, body fluids, and through the birthing process. at this time, I'm a little nervous. Can I pass it over to Richard?
Yes,
Oh, you're
yes,
good.
yes.
You're
You're
good.
very proud about this.
Yeah.
You're good. You're good.
No problem. So it's a really, really important question. Hepatitis B is a liver virus, as Lena said. So, Lena, you had it right. It is transmitted through blood and sex, but what most people don't know is primarily in the Asian and Pacific Islander community, it is transmitted. This is more than about 90% of cases via mother to child transmission at birth. And I'm sure we'll get into this more because there's a lot of stigmas where people just assume it has to do with promiscuity and having many sexual partners. But like I said, that's not the majority way it's transmitted. And unfortunately, the way the virus is, you don't feel sick for most people when they get it, especially at birth if they're contracting it from their mom, because their mom will not know that she has it. She doesn't feel sick. And so she then passes it on during the birthing process to all of her children. Their children grow up. Again, they don't feel sick. But 1 out of 4 people who do get this virus that stays in their body the whole life go on to develop serious liver disease or liver cancer that usually kills that person. And so I like to say that the scary facts about this disease is that 1 in 12 Asian American Pacific Islander adult immigrants has this disease. So if you think about so many of our peers, especially, Daly City, San Mateo, many of those folks who came from Samoa, Tonga, we have aunts and uncles or parents that age, you're thinking 1 in 12 have it, but 2 out of 3 people who have it don't know it because most people don't feel sick. So it's like you can think of it as this ticking time bomb.
So Richard, when you say 1 out of 12, is there any perspective setter, like in the white population, for example, when it's 1 in 12 in the Asian American Pacific Islander communities, is that a high number? Is that a low number?
It's almost like I fed you that question. It is 1 in 1,000 or even less. So much so that the CDC, Centers for Disease Control, says that this is, if not the greatest, is one of the greatest health disparities between Asian Americans and Pacific Islanders and the rest of the U.S. population. So if you can think about that, 1 out of 12 versus 1 in 1,000 or less.
Exponential difference.
Yeah.
So, and Lena can speak about this as well. When you talk about stigma, when you talk about, those things that they're a big deal in the Pacific Islander communities. Do you talk about your health problems? Do you even go to the doctor? Where do you get your healthcare information? All these kind of things. Kind of like to get Lena's perspective of why this being an unknown kind of deal, situation, why it's so important to the Pacific Islander community that we shine light on it, because there are some things culturally that we really need to catch up on. Maybe you can talk a little bit about that, Lena.
Sure. This disease has a lot of stigma, right? I mean, there's some like, especially around promiscuity, right? There's that, there's those myths, and then it causes a lot of mental health issues in our community. And I think when we talk about going to the doctor, we don't usually go to the doctor until it's too late,
Right.
and it's like, I mean, my husband, for one, I'm going to say, and doesn't have to do with Hep B, but for Pacific Islander men, specifically my husband and a lot of Samoan men that I know, wives will say, go to the doctor, get checked. Oh no, I'll put it off later. They never go until it's too late. Right. I also like to kind of think about the reason why our parents came here to this country. My father came here, and a lot of our fathers came here because they wanted to bring some generational wealth into their family, right? And so they come here and they work so hard that they believe that all they do is put their time into working for the family and taking care of them first. But they don't ever think about generational wealth in terms of health. You know,
Mm.
you can't really provide for your family. You can't provide any generational wealth for your family if you're unhealthy. And it's not in our cultural. We don't, Samoans, we don't really go to the doctor a lot,
Right.
and it's not something that we normally do. We always, we don't have a lot of time, to be honest. I mean, I feel like we just go work, we go take care of the family, we rest, and then we go to whatever free community events that we have that we
Yeah.
can make it to. And then, if there's like a free checkup going or whatever, then maybe we'll do it, maybe we won't. But we just don't think about ourselves that way, because I feel like when we put ourselves first, it's like, oh my gosh, I'm putting myself first and forgetting about my family. So I feel like
Right.
culturally we don't usually do that, right? And then when we are sick, that's when the entire family comes and is like, oh yeah, let me help you. What can I do? Well, what we should have thought about before this happened was, what should we have done before this
Before.
even occurred? And so the
Yeah,
way that we can do that is through our community organizations, like our health community organizations, and getting
I think
educated and screened. Sorry.
I think the one of the things that the Samoan, the Pacific Islander communities are hampered by is just normal preventive checkup. Kind of to your point, like unless a bone's sticking through the skin, like why I'm not going. It's usually to the ER. If you're going to go
Mhm.
someplace, it's going to be for something extremely urgent. Regular checkups, maintenance kind of things, just they don't happen as much as they should. And so when you have this kind of situation where most people don't know they have it anyway, I would think that the Pacific Islander, the Asian American and Pacific Islander communities are higher risk because of the way that healthcare is treated in these cultures and these communities. So to Richard and Stuart, is that what you found in your work with at underserved communities, that the being involved in the healthcare programs and systems and understanding how to navigate insurance and all that kind of thing is a barrier to minority communities?
Yeah, I
Well,
think
I think more than
so.
just that out. When we first started in SF Be Free, a lot of the issue is because it's the immigrant population. So what they're fearful of, oh, if I have a disease and it's found out and they have their green card, they're going to have their green card taken away, huh?
Mhm.
In the beginning, we even had immigration attorneys come in and speak to them and tell them, no, the government will not take your green card away if you have a chronic disease. You can immigrate here if you have HIV, if you have cancer, if you have hepatitis. The government is not looking at that to deport you. But you have to understand, these immigrants, when they come here, right, they have this mental block about, I don't trust the government, right?
Right.
So part of the barrier and the stigma comes from where they immigrated from to the U.S., not knowing all the rules. And it's really, and I can understand and empathize with them that, hey, they're not going to believe everything that's said, right? Especially when they have that green card that is so valuable and important to them, that they're not going to risk anything in losing that. And so, as Lena pointed out, their most important thing is to take care of the family. It's not about taking care of oneself. And unfortunately, if you don't take care of yourself, you can't take care of the family. And I think that
Right.
was one of the points that Lena was pointing out, that, when you get sick, everybody comes around now, but it should have been beforehand. I think preventive medicine is very important. What we do in SF Hep B Free about screening, vaccinating, promoting follow-up with physicians if you're chronically infected, that's the important part. That's the preventive part of cancer, because Hep B is the number one cause of liver cancer worldwide. And so it's important that we get our population, our high-risk population, our aunties and our uncles screened, so we know their status, and then that they can get their appropriate follow-up and care.
That's one of our community sisters, Cree Mawia. One of the big campaigns she's always pushing is, you need to get checked. You need to get checked. You need to go in, get checked for whatever could possibly be there. And I think that's kind of it's a big thing in the community, is how often are you, kind of like getting touches and opportunities, right, to be seen or have a physician catch something is the less touches that you have with a doctor, be it a, even an eye doctor or I go to the dentist, they take my blood pressure before we start the dentist appointment. Just the less times that you're getting involved, the less likely you are to catch anything early, which sounds like it's extremely important for Hep B to catch early. So I'm a prostate cancer survivor, but really men don't look for prostate cancer until later in life. With Hep B, is there a time frame that men are getting? I think 40, 50s where people are starting to look for prostate cancer. Just as an example, you wouldn't look for prostate cancer in a 20-year-old male. How early can you start looking for Hep B?
Yeah, so I'll take this one, Stuart. So the nice thing about it is, because most people get it at birth, you want to get tested as early as possible. And so we recommend the WHO and CDC, they all recommend that if you are born in any of the countries that have a high burden of this, which is pretty much all the East Asian, Pacific Islanders, Southeast Asian nation, as well as most of Sub-Saharan Africa, that if you're born in any of those, you should definitely be tested. And this is one of those easy things. It's like instead you just go in, you hopefully go in for your yearly checkup, although we know lots of people don't do that. And you just say, hey, can I also get this Hep B test when you're taking all this blood out of my arm anyway? Unfortunately, it's not a test that's automatically done because
I was going to say you have to ask for it.
Yeah, which is annoying and terrible because you have to know what random normal person is going to be like, oh yeah, I remember that one podcast I listened to. I can do this, which is why we also go out and educate doctors about the risk. But back to your question, you can get tested, and once you know that first time, then if you are infected, if you're not infected, you can get the vaccine, which most kids in the United States, almost all of them, get vaccinated close to birth. And so it's once you're vaccinated, you're protected for life. So that's easy, one and done.
Oh, that's awesome.
Yep. And then if you are infected, what's nice is that if by catching it early before it's become serious liver disease or liver cancer, you manage it with your doctor. And by managing it, most people, more than 60%, live full, healthy, totally normal lives. And even when I say manage, you may think, oh, is it going to be something like dialysis or this really expensive drug that I have to take 10 pills a day? Not at all. Almost the opposite. For about 50% of people, that management is simply 2 visits to your doctor per year. And so once every 6 months instead of once a year. And they will test some liver numbers and liver health indicators. And for that 50%, the doctor will say, your liver looks great. Your numbers look great. See you in 6 months. That's it.
Nice.
For the other half, the doctor may go, oh, your numbers are starting to rise in the direction we don't want. Something looks a little off with your liver. I'd like to start you on this pill a day that has no real side effects. It's not like some of those old HIV drugs that made people live terrible lives. And you take that pill once a day like you would aspirin for a high blood pressure. And that's it. And it's covered under most health insurance. And the nice thing about both the testing and vaccination is both of those are covered under Medicaid and Medicare. So really, we have, as the medical establishment, all the tools we need to continue preventing any serious disease from this virus.
So actually, I have like tons of questions, and I'm like running over Naki's. I'm giving Naki a chance to get in here because I'm like, okay, what about this? What about that? What about this? Go ahead, Naki.
No. I was just, is there, tell me about the testing process. Like a lot of people are scared to, what's going to happen when I go in, how many vials of blood are they going to take? Like what does that look like when you go in to get tested?
Yes, we totally understand that concern. And the nice thing is, it's fairly simple. Unfortunately, it's not as easy as a cheek swab or, the COVID test or a thumb prick. You do have to get a phlebotomist to take blood from your arm, but it's just like they would at the doctor. And in fact, even less, because at the last doctor I did, they took 3 vials or something.
Yeah.
And this one, they just take 1. It takes literally maybe 3 minutes if you don't count the form filling out. and they will just send it to the lab for processing, and you'll get your result back. And your doctor, if they're a decent doctor, should explain what it being positive or negative means. And when you get screened with us in the community, you can do it right there. We have a phlebotomist that comes totally free of charge, no insurance necessary, no proof of anything. We just need an address to send the results back to you. And it's as simple as that. Otherwise, you can again get it done at your doctor, almost always free. I have yet to hear of any case where the testing was not free, because it's as you can imagine, a preventative service, right? This is going to prevent you from getting liver cancer.
Stuart was talking about earlier.
So also with screening.
Go ahead.
I'm sorry. It's important that with hepatitis B, we like to say it's a one and done. You can get the test and you'll know your results and you know where you have to go. So whether you need to be vaccinated or you need to be followed up with your physician, that's important to know. So here in California, all pregnant women are screened for hepatitis B. Whether they're foreign-born or American-born, all mothers are screened for hepatitis B. To find chronic carriers in moms, so that when they pass it to their newborn, we have medication, HBIG, which is an immunoglobulin, and the vaccine. We give it to the baby within the first 24 hours of life, and that will guarantee to just eliminate the virus, so you don't even have to worry about it anymore. So you have this tree. And so if you can treat that infant immediately, you can snip that brain and you don't have to worry about hepatitis B. With hepatitis B, the screening, as Richard alluded to, if you're negative antigen, negative antibody, that means you should probably get the vaccine, even as an adult. Because if you love to travel and hang out, it's important to get it done. Adults are required, but highly recommended to get the vaccine. Adults are recommended to get the vaccines. Those who have diabetes are recommended to get screened and get the vaccinations, because the end result of diabetes is liver failure, and they have to go on to dialysis. So that's important that you protect yourself. Also with hepatitis B, when the child gets it, or not when the child gets it, but when the child gets the vaccine, they're protected for life. So that's important to note, that the vaccine will protect you for life. And it's also the first cancer-preventing vaccine. You talk about the papilloma vaccine, but this was the first one. It was discovered in the early 80s. It was out in the mid-80s, people. And so we have the infrastructure in the U.S. where we're able to provide the vaccine. Now, if you're chronically infected, that means you have a positive antigen and a negative antibody on the screening test. That antigen, remember, antigen is the bad stuff. That means chronically infected. With that, as Richard said, you want to visit your physician where he'll do additional tests, whether it's liver function tests, ultrasound of the liver, a CT scan of the liver, to get a baseline on what it looks like. And you just follow up. Just because you have a bump in one of your visits with the doctor, that doesn't mean, because unfortunately treatment is lifelong. So they want to delay giving the treatment until they're for sure. So they run other additional tests.
Sir, yes. Sorry, unfortunately your mic quality is making it sound a little bit like an EDM remix. Yeah, I'm not sure. My only suggestion is maybe if you're using your phone, maybe if you pull it away from your computer, maybe there's some sort of feedback from your computer speakers. But sorry about that. But
we got the gist of the information
for the Pacific Islanders out there. He said if you like to hang out, or if you're at risk for diabetes or have diabetes, like there was a whole bunch of if this, that as you were listening as a Pacific Islander, I'm like, oh, check. Right. So yeah, a lot of those, what Stuart was saying, that like you like to hang out, you like to travel, like we're, a ton of us are going back out to the Pacific. We're trying to figure out when we want to go there next year. We're always hanging out. There's cultural events like every week, sometimes more than one a week. And diabetes and obesity are, that's rampant in the Pacific Islander community. So I guess my question is, so when I hear that insurance is covered by Medicare and Medicaid, and I hear that there are there's measures that are really not invasive. The testing process isn't like, if you're getting blood labs, you can just have them tack that test onto the blood labs that you're getting already. Everything seems pretty simple. Is it just awareness at this point that needs to be pushed? Because when I hear insurance is signed off on it, I'm thinking, well, then there shouldn't be any hang up. And then especially the tests aren't, you're not given bone marrow or something for the test. You know what I mean? Like it seems like, why wouldn't everybody do it? Is it just awareness now?
Absolutely. And that's what I mean, again, Carl, it's like I fed you certain questions. But I'm so glad you're asking those, because that's exactly it. People, after hearing about just going to your doctor, do that 5-minute blood test and then you're perfectly good. People are like, wait, if it's so easy, how come none of us are doing? What's the catch? What's the hook? And I'm like, there is none. Unfortunately, the biggest problem is just, quite frankly, numbers. The U.S. population is only made of 6% Asian and Pacific Islanders. And so, when people come up and ask, hey, if this is something we can solve so easily, even though 2 million Americans have this disease, and again, 2/3 of people don't know that they have it, they're like, why don't we just require everyone to get tested? Well, we only make up about 6% of the population. And so it's not one of those required tests that the doctors have to do at your annual checkup that the federal government requires. And so, unfortunately, it's up to us as informed community members, or as a physician who knows, the right risks for certain populations. And unfortunately, we've asked this to doctors who say, we learn about Hep B for maybe 5 minutes in med school. It's just a blip on the radar. And that's never going to go back into their memory when they have a million other things to worry about, especially if most of their patients aren't Asian. Now, fortunately, in the Bay Area, with about 30% population Asian, we have some better awareness, and our physicians have some better awareness. And so we've had a mixed bag. When we go out to physicians to educate them, we get some, especially those who are working in low-income Chinatown, Northeast Medical Services here, Daly City in San Francisco, who say, oh, it's our standard. Every person who comes in, because we serve 85% plus Asians, Hep B, Hep C, testing done. But for example, we went to a very, well-known, prestigious health network on the peninsula here. And when we did this presentation, I asked their head doctor of primary care, so how do you know who's testing for Hep B? And he said, well, we don't. And I said, what do you mean? He said, well, we kind of, this presentation is good. We hope that our doctors know. I think some of the 20 doctors in the room probably do it regularly if their patient is Asian, but half of them don't. And that issue, a guy came up and said, hey, thank you so much. I have a bunch of Asian patients. I never really do this. I forget. I feel like most of my Asian patients are more American born. So I forget that, I should make sure to test my immigrant patients. So thank you for this presentation. This is important. I'll try to remember. So we know the work that we're doing out there is important, and that unfortunately people are being missed.
Yeah, I think if this were an issue that was this dangerous to 90% of the population, it would be MMRH, measles, mumps, rubella, Hep B test. That, when you get inoculated, that would be just added on there automatically. So Lena, Naki and I had done a focus group, right? We did a focus group for tobacco, and one of the questions that we asked was, where do you want to get health information? So not just information about smoking or tobacco, but where does the Pacific Islander community want to get health information? And overwhelmingly, we heard that they want to get it from their community. They want to get it from their church, their faith leaders. They want to get it from community-based organizations and their elders. Somewhere down the line was physicians and doctors, but it was like not 1, 2, or 3. And, it was really the community. That's where the community wants to get health information. How can we do that with the Pacific Islander community? How can we push the Hep B awareness so that it reaches the Pacific Islander community?
Well, I have a couple of things that I that I want to share about information and in our community, right? So I believe that there are so many reasons that community organizations are important for us, because as Pacific Islanders and ethnic people, we often are drawn to our own communities because it offers a safe space, right? And in those safe spaces, we can go to our resource leaders that are there and ask for certain things without feeling overwhelmed or feeling embarrassed, because they're going to be there to help. That they're there to help you. They're kind of like the wayfinder, right? So I think that for local communities, providing these like community fairs and collaborating with community organizations like ourselves and other healthcare communities, when those two organizations get together and help to forge a relationship with our own community, that allows our community to become their own health advocates. I feel like we need, like for SFFB, I believe that we need to get more data on our Pacific Islander community, because that is low, right? At this time, the numbers are low for Pacific Islanders. And in order for our organization or any organization to go into a Pacific Islander space or ethnic space, we have to build a relationship. We have to build a trusting relationship. And so we look for community voices, trusted community voices like yourself, and also through different education, arenas or platforms, right? Different platforms to get education out. Um, and I also think I think I'm going all over the place, but I feel like data is important for our community work, um, so that we could, like help to identify who needs screening, who needs linkage to care, and how can we get this education so our community can get these resources, these free resources to help eliminate Hep B.
I think data is extremely important. I think we learned that really it was starkly evident with COVID, that getting our data disaggregated and being able to see data specific to certain populations was important. And just what Richard said earlier about when he said 1 in 12, I was like, well, is that like a lot? Is that not a lot? Like, and then the data, then you get to see like, wow, it's exponentially bad. It's not like 2 times worse or 20 times. Having that information specific to the population is important. Stuart and Richard, have you guys found that having data helps communities really understand it and embrace it? I mean, you say data, people kind of roll their eyes and it's too clinical, but when you say numbers and things like that really apply to people, I think it hits home better.
Yeah, Stuart, sorry, I'll just take it so that the sound works a little bit better. Absolutely right. And I think that's one of the biggest issues. You've heard, I don't know, in public health, there's a big thing called disaggregated data, right? And there's actually a big problem because often Pacific Islander is just lumped into Asian American, and those populations, don't get me started about the different East Asian countries, but also all the Pacific Islands. There's so many differences, particularly and unfortunately, a lot of the East Asian country immigrants have been doing quite well for a long time, and all these Southeast Asian countries and Pacific Islander countries have lower achievement kind of success. Yet because they're lumped in, everyone says, okay, they don't need anything, which is almost the opposite. In fact, I think I was recently reading a report where Pacific Islanders and certain Southeast Asian populations have a lower high school graduation rate than African Americans and Hispanics, even though that is like not something that most non-Asians think about. So there's definitely achievement gaps there. But the only way we can know that and then get federal or state resources if there's numbers behind it. If we can say, in that report, it was looking at the number of graduation rates, but without someone doing that research, we can't solve that. And that's a big problem here, even not only for scientists who get to dictate the money for policy makers. But within the community, when I go out and do educations, folks are always like, okay, we see the giant big 1 in 12 number, which is scary. But what about for us Chinese? What about for us Vietnamese? What about, for us Filipino Pacific Islanders? And it's really hard to tell. I was just in preparation for this interview trying to find Samoan, Tongan, Fijian numbers. And there is a very little out there. And the numbers that are there are modeled out. For this opportunity, I just looked at Tongans and the Marshall Islands and American Samoa, and it's about 5% of the population modeled out that have this disease, which is 5 out of 100. And so this is still considered a high threat in those areas. But to get to the answer on, Carl, where can we get this information, Hep B information and guidance in the community? That's exactly what Lena and I are working on, because we are realizing that lots of folks aren't going to go do the research on their own, be visiting their doctors, or see the one article we can put out in Filipino radio or newspaper. And so we are working with, Lena is working with churches, different other nonprofits. I think there's one called like Samoan Solutions.
Yes.
Folks just like you guys, because
Right.
that's where people are going to get their information. That's where they're going to get that trusted voice that says, hey, I heard this on the radio. Maybe I'll go to my doctor finally and figure this out. And so we rely on folks just like you, Naki and Carl, to allow us a platform that can be trusted so that we can do that. And so we're hoping this end of this year, early next year, to do more radio shows, go to more churches, go to more Pacific Islander kind of community gatherings and restaurants, anywhere where you're going to see Pacific Islanders in the community, we'll try to be there. So now I'm making you guys commit to us that the next bunch of events that you guys know of, you yell at us and we'll be there.
Yeah.
Awesome. Can I ask you, and I don't know if this is off topic, but what is AB 789?
Yes, great question. So awesomely, we were able to help pass actual California law this past year that should help for hepatitis B and hepatitis C. So the AB is simply assembly bill, jargon for the law that gets passed, and then the number is arbitrarily assigned. It's just kind of fun that it ended up being 789. So the law says that in the primary care setting, like when you go regularly visit your doctor, that they are required to offer a voluntary Hep B and hepatitis C test for those at risk. And again, when we said at risk, we mean Asian Pacific Islanders, Sub-Saharan Africans, anybody who falls into the category officially determined by CDC and federal guidelines. But for our knowledge, you can pretty much say if you're Asian, you fall into that category. Now, in our head, hypothetically, that goes, okay, cool. We're going to catch all those people that are missing, all those 1 in 12s, all those 2/3 of people who don't know. But unfortunately, in order for us to pass that law, we had to say that there wasn't any penalty if you didn't do it. And so right now it's up to advocacy groups like us and you and everyone in the community to kind of hold our clinics, our doctors accountable to actually do it. And so one of our biggest projects this upcoming year is using our resources to go to clinics, Kaiser, Stanford, CPMC, UCSF, and say, hey, what are you doing for this law that you're supposed to be following? Are you offering that Hep B and C test? And what can we do to help you so that you're following this law, even though you're not getting penalized if you don't? So that's the conundrum.
Can I make a comment? I want to go back on the data, So, I mean, I think that a lot of our Pacific Islander community are like, well, when we think about data, like we said earlier, that sometimes it's just got a bad negative connotation to it, right? Nobody wants to really participate because where's this data going, right? But data for Pacific Islanders, specifically for Samoans, I believe that data can come in the form of lived experiences and stories, right? We don't usually think about that. And so for Richard Stewart and I to be able to experience these types of stories and lived experiences among our Pacific Islander groups, we need to be invited into this space. And until we are invited, you know, until we are invited, we need to forge. We have to try and forge this relationship with our community groups that are in the area, right? And that becomes a lasting relationship between us so that we can understand what our organization, Richard Stewart and I, are trying to do, you know. And basically, like I said earlier, it's just trying to help our community understand that you are the person who is in charge of your own health, and therefore you need to be educated in a way, you know, that's going to motivate you to want to go out there and get the testing, you know, and get the preventative care, and then also share it, right? We talked about stigmas earlier, and you know, I know I'm rewinding, right? But we talk about the stigmas in our culture, and always it's that, she went over there. That's why she got hepatitis B, because she's
Right.
all over the place, right? And then
Everywhere.
nobody wants to, you know. And then it's like you go to church, it's like, oh, her auntie said she was all over there, all over the place. Don't tip
Right.
her, you know. It's just that just goes on from generation to generation. But you know, if we still stay in that space of not wanting to you know, further the education and look out to other resources in our community other than PI community, we will not, you know, we won't have data. You know, we'll still be the culture that's like, oh no, we're gonna be pushed in with all the other people. You know, we won't have that. You know, so we Richard and I will be trying to focusing on hitting all of our community organizations with you folks so we can build that relationship. And I know everybody's been a little excited to learn about Hep B, especially we have a education presentation for the SCD staff on
Nice.
December 20th, where we'll be giving out our presentation on Hep B, and they're excited to learn more about that. So that'll contribute to the data that we're trying to build so that we can identify where we need to help.
I think that we're more likely, we live in multi-generational homes, so there's more likely to be giving home care. We're more likely to be taking care of our elders or our family members. So the education, if you get into, and we were finding that when we were doing our census work, if we were getting into one house, you were getting everybody in the house because whoever the person was going to take care of that was going to address it with the entire family. And so, you know, with a community that is so into home care, health care of loved ones, I think that the awareness piece can spread, it can work for us too, in that it can spread pretty quickly. What does success look like? So like when you move the needle, if you look at this in 2024, then to 2024, 2025, what would be a marker or a scenario where you would look at it and say that we've been successful in moving the needle?
Yeah, great question. Man, Carl, you should be working for us. So
Are you hiring? Because they'll come.
for us, the kind of anecdotal like litmus test would be if we go out into the community and say, "Hey, do you know what Hep B is? Have you been tested?" And people to go, "Ah, God, you guys have been pounding us for that for like years. Yes, I've seen my doctor. My pastor told me to do it. Yeah, my favorite radio show told me to do it, so I did it 2 years ago. You know, I don't have it." And then for me to be like, "What about your auntie, your uncle?" Be like, "Yeah, well, I went back home and told mom and dad, and my children were born here, so they're safe." That would be the success that I would hope to do. That would not necessarily require us to go to the Department of Public Health and go, "Can you look at the screening numbers this year?" Because healthcare systems in the U.S. nobody's sharing any of their data, so we wouldn't know if you had Kaiser, we would have no idea how many people are being tested. But that general saturation of knowledge would be my kind of litmus test, combined with an understanding of the stigma and the dispelling of misinformation, which is one thing I want to discuss for just a moment here, so that we're clear. So hepatitis B has both this chronic version, the one we've been talking about that creates the liver cancer, and that is almost always contracted in infancy from a mother who also doesn't know about it. And so it's not like she's been sleeping around. She probably contracted it from her mother who didn't know about it. And it's just been passed generation to generation to generation. Now, there is, as we said in the beginning, you can catch the virus through sex or blood. So it is transmittable also through intravenous drug use, which is also a stigma. People are like, oh, so someone must be a drug addict here.
Yeah.
But that version is called acute hepatitis. And that version that's passed if we're adults. So, Carl, if I just stuck you with a needle with hepatitis B today, you would, if you weren't vaccinated, you would get sick for maybe about 2 weeks. And then your own adult immune system would fight off the disease and you would get better. And you would now have antibodies for hepatitis B and you'd be protected for life from it. So, and then it wouldn't cause the lasting liver damage. So the funniest thing about this disease, which I'm always explaining, especially to pastors, is if you were like promiscuous and were sleeping around and got hepatitis B, we wouldn't know it anyway, because within 2 weeks, you would be self-cured of it and your blood wouldn't show that you have the disease. The people whose blood will lifelong show that they have the disease are the people catching it in infancy from the birthing process. And so as advocates to fight Hep B, we focus much more on this lifelong one that makes you much more likely to get liver cancer, 100 times more likely to get liver cancer than the acute version, which is passed in adulthood, but is much less of a concern in terms of overall liver health. I know that might have been complex, but you can understand that. And it's funny, once I've told that to pastors, they maybe understandably go, oh yeah, then of course I'll talk about this, because they again are misinformed and they're like, oh, am I talking about something that's an STD that's going to pile up my folks? And if I say something wrong, but once I explain this difference, they're like, oh yes, of course we should handle this.
Right. So it can be an STD and it may not be an STD, but you're testing for the form that's not. I mean, if it gets caught in that net, then it gets caught in that net, but really you're far more likely to catch the generational, the Hep B that's passed generationally.
Right.
And the vaccine cures it?
So great question. So like most vaccines, vaccines can't cure, but it prevents infection. So, and that's one of the reasons why we as advocates say we should just vaccinate everyone, because let's say you get tested when you're 10 and you don't have the disease. Well, you get vaccinated, it protects you for life. So even if you did happen to sleep with someone who had chronic Hep B but didn't know it, you won't be infected because you've already gotten the vaccine and are protected. Or let's say you travel to rural Samoa to visit a village, and then you accidentally break your leg and need an operation, and you're worried that the blood transfusion isn't safe or the medical tools aren't safe. Well, if you've got vaccinated, you're still not going to catch it because you've gotten vaccinated. So it's really, really simple. Just get tested, get vaccinated. You'll be protected for life, and let others know. And we will wipe this disease off the map.
Stuart.
So, Naki.
Yeah. Yes.
Oops, sorry.
No, I was like, Stuart, yes, we can hear you.
So what Hep B was, we also copied HIV, huh? We want people to know their status, right? That's so important to know your status. And in terms of, Carl, you asked about education. What educating? The Hep B virus is 100 times more virulent than HIV. Huh? So if you were to get a drop of HIV in your system, you probably would not contract HIV. If you had a drop of hepatitis blood, you would get it. So in terms of knowing the status, that's important. And with our SF Hep B free organization, our mission is about awareness and education. And to us, those are two different things. Awareness is bringing awareness about the disease, hepatitis B, what it is. And then the education part is that, hey, this is what you can do to one, if you are chronically infected, follow up with your doctor. If you don't have Hep B, get vaccinated, and then it'll be fine. But it's interesting what Richard brought up. So if you have an infant who was born to a chronically infected mom, that baby will be chronically infected. So studies have shown that 96% of babies born to mothers who have chronic Hep B will go on to develop chronic Hep B. In adults,
But do we
it's the inverse relationship.
Do we
Pardon?
test babies right when they're born? Do we test babies right when they're born? Like you're saying?
No, it's not necessary. What they do is they test the mom. It'll be the same blood.
Yeah.
And so what they
Should
will
we
do if the
ask
mom
for
is
it?
chronically infected, it's done automatically. It's mandatory to do it.
Got it.
So right
And
now,
so when the baby is born, they're given the immunoglobulin, which is what fights the virus and gets rid of it. And then you're given the vaccine, which will prevent you from getting it. So remember, the vaccine for children is 3 shots. For adults, they have the 3 or the 2 series.
yeah.
Got it.
So, sorry again, Stuart. You're cut out as a couple ones. So
Oh, I don't know why. Sorry.
Yeah, no, but we got the point of that.
Yeah, just to be clear,
I'm learning.
You would only since about 1993 to 1995, Hep B got added to the list of all the diseases that pregnant moms get tested for, just because worrying about baby health. So now, if the mom is test positive, they're like, oh shoot, you should start treatment, talk to your doctor, and then we'll also give all the things Stuart says to the kid so that the kid doesn't contract it at birth. And this is the actual structure of how we reduced, or how the world, the WHO, the World Health Organization, reduced infection rates across Asia, East Asia, and Pacific Islands. It used to be something like 10%, 12, 15% of folks in those countries had Hep B. In about the early 90s into the late 90s, they started all these vaccination campaigns where they would test the mom and then give the babies this birth dose. And now at those born rates, it's like, less than 1%. And that's what's resulted in this huge public health success of decreasing the amount of Hep B. And so we're out here going, yay, that's fantastic for all the next generations. But what about our aunties and uncles and the people that are here now and in their 30s and 40s already?
Awesome.
Yeah, I think culturally too, for someone, people, the transmission of hepatitis B, right, comes not only like when we say you get hepatitis B from needles, right? You can also get it from piercings and also from tattooing, And so when we think about getting our traditional tatau or solaimiti or malus, right? We don't think, back then in those days, they just did it with the sharp tooth, the squid ink, and the tapping, and there was a lot of blood involved and a lot of hands as well. So, just from that scenario, you could have seen how hepatitis B might have like some generational, how it travels from generation to the next generation unknowingly, right? So I mean it's interesting because a lot of Pacific Island cultures and ethnic cultures too, we do a lot of piercings and tattooings. We don't realize how hepatitis B is transmitted.
Great point. Great point.
I love that they use gloves now. Have you noticed that, Lena? Like a lot of most tattoo artists use gloves now, even in Samoa. So I think we're somewhere something is getting in their brain.
I do want to clarify one more thing before we run out of time, which is in addressing the stigma is we've talked a little bit about how folks get it. And one of the things we see a lot in Asia is someone will say, oh, I know how Hep B. My uncle who lives in our house has it. And so he lives in a different part of the house, has his own bathroom, doesn't eat with us. We don't hug or kiss him. And now we're safe. And we're like, what? Because as you said, it is transmitted through blood and sex, but nothing else. So that means in breast milk, in urine, in saliva, none of those are going to transmit. And you can imagine, and especially cultures like ours, multi-generational, family matters, you can imagine isolating one member like that, how terrible that would be. And so we go in and correct that and say, hey, like, it's cool that you recognize they have this disease, but you know, he can eat at the same table. He can hug and kiss his children
Mhm.
and grandchildren and grandparents. And you know, the only thing would be if yes, if he's profusely bleeding from the mouth and you're profusely bleeding from the mouth, then you probably shouldn't kiss each other. But um, it's only transmitting when in those certain circumstances, and so
That's
that's
a good.
all.
That's
Mhm.
a really good example of what you said earlier. Awareness would be being aware that he does have Hep B. Education would be you don't need to isolate.
Isolate.
You don't need
Yeah.
to lock them away in a room. Difference between education and awareness.
So is there anything, Stuart? Oh, we're gonna start with you because you're scratching over there. Is there anything that you'd like to get out that we haven't covered before we let you go?
No, I think we covered a lot. I think it's important the education part, right? That Hep B is passed on. If you just remember BBS, right? Birth, blood, and sex, where the last two is not as important as the transmission from mother to child is important. Remember that hepatitis B is 100 times more virulent than HIV, so it is
Mhm.
important. Hepatitis B is treatable. It's not curable yet. They tell us another 5 years, but they've been saying that like every year for the last 20 years. In 5 years, we'll have treatment. But in all honesty, they really feel that in the next 5 years, there will be a cure for hepatitis B because now they're on patient trials. So that's good. So that's a good thumbs up. It's important that in reality, especially in the Bay Area, that everybody should be screened for hepatitis B because we have a lot of mixed marriages,
Right.
right? If your
Right.
partner is going to be from a high risk population, high risk country,
Mm.
you should protect yourself, So that's important. So I appreciate you giving us our time here to talk about hepatitis B. And thank you.
Thank you
Richard?
so
Thank you,
much,
Stuart.
Stuart.
We appreciate that.
Richard?
I think I'm just going to leave with kind of the action item and a couple big picture things. So everyone knows about HIV. People are terrified and it makes all this money from people supporting it. But just so everyone knows, there's about 38 million people with HIV worldwide. There's 300 million people with chronic Hep B.
Wow.
Yeah, 10 times as many. Yet nobody knows about Hep B. And yet, unlike HIV, where after decades and decades we can barely handle it and treat it, we have a workable, cheap, and effective vaccine. We have workable, cheap, and effective screening, and workable, effective treatment for Hep B as long as you just get tested and know your status. For everyone listening out there, I know work is busy, life is busy. You don't want to visit the doctor. You're super strong. You're Islanders. That's just the way life is. And we see this when we go out on screen. I ask you 5 minutes. Just go visit your doctor for 5 minutes. Get your other tests done. Ask for this one test. Get the results. If you don't have it, fine. Get vaccinated, and you never have to worry about it ever again. You never have to worry about the 100% increased chance of liver cancer ever again for 5 minutes of work. And if you do
That's
have it,
awesome.
thank God that you caught it early. And if you manage it with your doctor, it won't ever become anything more. So that's what I'm asking you all to do. Just this one thing, and we can help you. You can visit sfhepbfree.org. We have all this information where you can go. You can call me. I will make sure Naki and Carl have my personal phone number, and I will help you find care. If you're uninsured, I will help you find care. If you have insurance and don't want to figure it out, I will figure it out for you.
Awesome.
Yeah.
Thank you. Thank you so much, Richard. Lena?
I just echo what Richard is saying, but for I'm going to go back to data for our community. If you don't want to go to the doctor and you don't want to do those things, we will come to you, to your organization. We will educate you. We will screen you, and we will work with you to find linkage to care. And we will also, break bread and share bread and make more bread. Right? That's
Right.
what we like to do. So I know that's probably cliche, but I just wanted to say thanks so much for having us on.
Thank you
Thank
so
you.
much for the great information. I learned so much. And thank you for educating us on Hep B vaccine. The number that you just blew me away with compared to HIV and hepatitis, that blew me away. So
Data at work.
Data and every, thank you so much. We appreciate your time. We appreciate the work that you're doing. We know that you have a lot of upcoming events. Samoan Solutions has their Turkey Trot November 19th. You can find them there. They're also will be at SCDC Samoan Community Development Center December what, Lena?
20th for their staff meeting.
December 20th. Check out their webpage. Check out Lena. Follow them on social media. Stalk them like I do. Get all the information that you need. Stuart, Lena, Richard, thank you so much for your time. We'll see everyone next week, every Thursday at 6 p.m. Come back to
Thank you,
Faika.
Carl. Really, really appreciate it. We couldn't do our work without you guys.
Love you all.
Love you
Thank
guys.
you.